Welcome to MS Research Australia's Research Report. I'm Dr. Hamish Campbell, and in this series we explore the research that's going on in Australia and around the world. In this episode, we meet Dr. Keri and Dawes, two clinical neuropsychologists at the Brain and Mind Centre at the University of Sydney. They are currently recruiting people with any type of MS in Sydney to take part in a clinical trial into cognitive behavioural therapy. Here they are explaining their project in more depth.
We're conducting some research here at the Brain and Mind Centre looking at cognitive remediation and behavioural approaches to treatment in MS. There's a very, very long title which we've called Combat MS. And what this research program involves is combining cognitive behavioural therapy strategies together with cognitive remediation strategies to target more broadly adjustment in people with MS, with the aim of improving general well-being and functioning.
Yeah.
So cognitive behavioural therapy refers to a range of strategies where we teach patients about unhelpful styles of thinking, kind of like thinking errors really, that can interfere with how they approach things in their life and can really form a barrier to functioning well. Someone with MS might think about wanting to go out, and they think about a time that they had gone out before and that didn't go so well, and so they think to themselves, I'm so tired, it went really badly last time, I'm not going to go out this time because it'll just be disastrous, and so I just won't do it and I'll stay home. So we teach them about catching those unhelpful ways of thinking, identifying those unhelpful thoughts, and then thinking about why it is that they're unhelpful and what they can do about it. That's the cognitive part of the cognitive behavioural therapy. The behavioural part is teaching them strategies like relaxation techniques, exercising,
Re-engaging in activities that they previously enjoyed that they may no longer do, teaching them ways to maybe adjust activities that they did enjoy so that they can continue to do those things.
The cognitive remediation part, well, that refers to thinking skills like memory, attention, planning, organisation, problem solving, and a lot of people with MS, actually up to about 70%, do have difficulties with their thinking skills. So what we do in the cognitive remediation component is two things. We teach them strategies to kind of get around cognitive difficulties. So if it's memory problems, well, we might teach them ways of chunking information so they can group it in their mind and remember at least some information, and that can be quite helpful for staying involved in work, for instance. We also use computer-based exercises which can kind of be thought of as weight training for the brain. So going to the gym and, doing some repetitive exercises to strengthen those areas of weakness. So it's a sort of two-pronged approach to improving thinking.
The ultimate goal really for running this research is so that people do walk out of this program with a new set of skills. MS changes over time. So the idea is that they come into this program, they learn skills to help manage their mood, their anxiety, their stress, their cognitive functioning, so that they can continue to adjust to having MS. So there is still time for people to be involved. We are running this trial just at one site, so here in Sydney at our MS clinic at the Brain and Mind Centre. But once we finish recruiting our final participants, we hope to then bring everybody in for their final appointment 12 months later and then start analysing the data.
Really, I think this is one of the only programs that we know of in the world that is actually addressing all the, multiple aspects of impairment or multiple problems that people with MS face. So we hope that people with MS will be able to access this as an efficient and possibly cost-effective way of addressing multiple problems.
Now that's an overview of the trial being carried out at the Brain and Mind Centre at the University of Sydney, and a brief explanation of what cognitive behavioural therapy is and how it impacts people with MS. Make sure you go to the MS Trials website for more information and to get involved. Also, make sure you like us on Facebook and subscribe to our YouTube channel for future research reports. I'm Dr. Hamish Campbell, and I'll see you next time.